We'll call this meeting of the Craven County Board of Commissioners regular session for Monday, September the 20th, 2021 to order. Madam Clerk, I would ask you if you will please call the roll.
Commissioner Mark?
Yes.
Commissioner McCabe?
Here.
Commissioner Mitchell?
Here.
Commissioner Smith?
Here.
Commissioner Liner?
Here.
Vice Chairman Booker?
Present.
Chairman Jones?
Here. If you will, please let's stand together as we salute and pledge to the American flag, which will be followed by an invocation from Mr. Grady. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
God of the faith of our fathers and Lord of our homage, we embrace you and one another in heart and soul, thought and mind, giving you praise and trusting your faithfulness. Bless this day and our activity in your service. O Lord, help us to remember that proclamation from ages past, where there is no vision, people perish. Enable us, therefore, to be visionary in our decision-making, particularly with those resolved in your wisdom by the leadership of our county. Grant this Board of Commissioners the ability to see, the faith to believe, and the courage to leap forward in their journey of determination for tranquility and peace, upholding those virtues by which all may benefit from in our home of the brave and land of the free. God of the Most High, may your will be done, your vision be known, and your righteousness prevail, both now and forever. Amen. Amen.
Commissioners, you have there before you your agenda, which was properly put on our website in a proper manner by general statute. All of it was delivered to you in a timely manner also. Are there any agenda items that you desire to remove or to add to today?
Make a motion the agenda be approved as is.
Second.
I have a motion and a second. Do I have any discussion on the motion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed? Motion passed. This morning we're honored to have with us two ladies, Ms. Jeannie Cook and Ms. Tracy Brenneman, who will come and give us our annual report on the Craven County Community Child Protection Team. Good morning.
Good morning. Good morning.
Appreciate y'all being here today.
Thank you for having us. So good morning.
Morning.
The purpose of our report is, of course, first slide, is to, of course, provide you all with recommendations that we have identified during our Community Child Protection Team meetings. Also ask for advocacy for systemic changes and also resources that we have determined are needed in the community. Normally, this report is done in May, but we have had some turnover in leadership, which is why Jenny and I are here today, and why the report is being done in August. Next slide, please. And you probably remember that membership for the Community Child Protection Team is also statutorily defined, and these are all the members. I'm not going to read all of the names out, but certainly involve many members of the community that are involved in human services, education, law enforcement, as well as parent providers and all. Counties often struggle to get members in all of these disciplines, so I'm very excited that in Craven County we don't have that problem and that we are fully staffed on our Community Child Protection Team. And then the next slide, thank you. These are the at-large members that are represented on the community. As you can see, there are 4 members. The only one that's not currently filmed is the parent partner, who is someone who has actually received our services in the community. And DSS has identified someone that we believe will be suitable to fill that, and they're in the process of vetting that individual.
Next slide, please. In 2020, there were 1,321 reports received by Craven County Department of Social Services, and of those, 62%, 813, met the statutory definition and were assessed. And looking at these numbers from 4 years ago in 2016, this is an increase of 5% of screened-in reports, and looking in from 2019 to 2020, there was a 1% of increase of reports taken. Some of this could have been from mental health needs. As you know, in 2020, we dealt with COVID. And so we have mental health and the restrictions of people being isolated to their homes. Next slide, please. Here are the statistics and the monthly average. Next slide. The contributory factor continues to be substance use. It's been an ongoing issue throughout the years, and it continues to be. Next slide.
Excuse me, Mr. Chairman. What's other?
Other could be issues like truancy, maybe a possible some dependency, things like that.
Thank you.
As you can see, our numbers from 2017 to 2020, we went from 30 babies born substance affected to 65 babies, which is a 117% increase. We do project that to be higher in 2021. We are, as an agency, are already working on some things that you'll hear about at our next presentation, that we're working as an agency and with the community to try to work with families and trying to get them engaged in services earlier. Next slide, please. Cps Unhome Services, this is where maltreatment has been found, and we are providing services to the family. The children remain in the home with the families. Sometimes children remain or outside of the placement in TSPs. But in 2020, we had 113 cases found in need of services. These are mandated services, they're not optional. And that there's an average of 12 cases per month required court oversight. Next slide. As I said, sometimes it's found that the child cannot remain in the home, but the parents are able to identify either a family member or a close family friend where the child or children can go stay while we continue to work with them and assess with them and so until the child can be placed back in their home. So in 2020, there was a monthly average of 39 CPS families with their children placed in a temporary safety provider's home. Next slide.
And of course, DSS works very hard to keep children in their home and try to provide those services in the home, but unfortunately, sometimes due to safety issues, those children do have to come into foster care. So 42 children entered foster care in 2020 for a total of 113 in DSS custody. 72 of those were due to parental substance use. So again, that's a huge issue for our community. And also at the end of 2020, DSS had only 10 licensed foster homes. COVID has definitely had an impact on the number of people able and willing to become licensed foster families. There's been a lot of risk for folks bringing children into their home. But I'm excited that Craven DSS has a new supervisor that's going to be heading up the Hope Family Resource Center. Her name's Holly Russell, and you may have met Holly. And she's very committed to doing all she can to recruit and successfully train new foster families as the need is great.
If you only have 10 foster homes and you've got many more kids needing them, what happens to those children?
I'll let Jenny,
We look at outside providers, therapeutic placements such as Easter Seals, OmniVision, and local providers like that, and see if we can place them there.
Okay, so they may not be placed in a home but they will be placed, they may not be placed in a home with two parents, a house like ours, but they will be placed somewhere.
They might not be placed with our Craven County DSS licensed home. They'll be placed in a licensed home such as Easter Seals and OmniVision. They can have two-parent homes. They're just not through our agency.
Okay, but they're not left in a bad situation is what
No,
I'm getting at.
Absolutely
Okay.
not, yeah. And the next slide, I'm actually going to talk in more detail about
Okay, they
that
are
as
taken
well,
to they're
so.
taken to safety.
Yes, we would not leave them in a home like that.
Okay.
Okay, next slide. So this is the data for from 2016 through 2020. The purple indicates the number of children entering care, and the brownish orange color, I'm not sure what color that is children exiting foster care each year. You can see that over the last 4 years, there's actually been a steady decline in the number of children entering foster care, with a slight increase in 2020, again, possibly due to stresses of COVID. We believe that the decline is due to a front-loading of services. Again, Department of Social Services works intensely with families to try to prevent the need to bring these children into foster care. And then also they work with the parents to identify what Jenny mentioned earlier, the temporary safety providers, which are often relatives of the children, or what we call fictive kin, which are people known to the children, but not necessarily relatives. So even if DSS takes custody, if these children can be safely maintained with those temporary safety providers and the court approves those placements, a lot of the kids actually stay in those placements as well, while DSS continues to work with the parents to mitigate the concerns.
Next slide. I'd like to share a few of our successes. Next slide. While we had to deal with COVID, I would like to say, on behalf of myself, and other workers and supervisors from Craven County DS, I really appreciate y'all advocating and providing funds for the electronics that we've had. Without those, we probably could not have done the services that we have. The iPads, the laptops, the cell phones allowed us to be able to provide these services to these families remotely, and allow for workers when, they could work from home, families that were positive, and we had to go out. During initiations, you have to have face-to-face contact. Y'all provided us and helped us with the funds for the PPE gear, and we were able to maintain the safety of the workers and the families. But again, those electronics and things like that really helped us be able to continue to provide the services to the families we need. It's quite challenging. We worked through it, and I felt like we've done pretty well. We've actually closed some families, and they were still able to get the services they needed. So thank you. Next slide. Supporting and educating the community. We were still able to, through the CCPT funds, to provide pack and plays for families. Safe sleep has been an issue. We continue to advocate for safe sleep. So parents, they're not sleeping in bed with their children, things like that. So we went from giving 19 pack and plays to 30, and we continue to have those available at the Family Resource Center. We provided 6 car seats, and in 2020, we held the annual Embrace Recover virtually. Next slide, please. Our Hope Family Resource Center continues to be active in the community. We were able to continue to have our Nurture and Parenting program virtually, which really helped families who were in their homes. They participated by their cell phones, iPads, and laptops. So we had 63 parents successfully complete the Nurture and Parenting program. We had 27 parents participate in the domestic violence assessments, and then 12 men and 8 women in the domestic violence groups. 29 children had trauma assessments, and we had 11 children participate in the trauma-focused cognitive behavior therapy, and 13 parents received the trauma training for the foster parents, which is huge when you're looking at the training for these children who have already received trauma, and helping these foster parents identify that and to continue to provide services. And then the grandparents raising grandchildren support group, we had 10 grandparents and 8 grandchildren participate that in 2020. Next slide, please. One of our programs that we have partnered with Benchmarks and with Trillium is Partner for Excellence. You'll hear me refer to as PFE. This is a huge program for Craven County DSS and the families that we serve. This is a program for children 14 to 18 years old, and it provides front-load services to families. They get them engaged with mental health providers from the beginning. When a child is found in need of services through in-home or permanency planning, they begin meeting with that provider, which has a higher level of training, and it's called the Gold Star process. It's not just a mental health provider who can do a CCA, a comprehensive clinical assessment. It's actually a trauma-informed clinical assessment, and they get that from the very beginning in getting engaged in services and front-loading those services, and it helps maintain those placements. The goal of this, one of them, is so children aren't moving around to multiple placements. They're getting those front-loaded services. They're engaging with the foster parents or the providers. The parents or the caregivers are meeting with those providers and meeting together as a group and what these behaviors are, and not waiting for the behaviors to start, like what they may see. Help them understand your child might start acting out in school, may start hitting, might start throwing, might act out against other children. Be prepared for that. So if that happens, start doing this, some services they can put in place. Next slide. And again, about PFE, if we started it in June of 2020, there were 13 children that were PFE eligible through foster care. And of those, you had 9 that was referred for that trauma-informed comprehensive clinical assessment. And the in-home services went live in October of 2020, and 7 children were PFE eligible, with 1 child referred for the trauma-informed clinical assessment. Again, front-loading those services. Next slide, please. Our Child Advocacy Center here, Nancy's house. I cannot say enough good things about Nancy's house. They have really been a huge benefit to families here in Craven County. Tristan Thomas and his staff there has been wonderful. There's been benefits to them having that local center here, where we were waiting for weeks to get into Teddy Bear, even months sometimes. We are now getting in services within a week to 2 weeks. 24 hours as a referral is submitted. I'm getting a call, or social workers getting a call, or supervisors getting a call, so giving us an appointment for families to come in and being seen for their forensic interviews or their child medical evaluations. That gives us an opportunity to go ahead and get that assessment going, seeing what services need to be put in place, and also they provide services, follow-up services there at the center. They have a family advocate, they have the trauma assessments, and they have the TFCBT. Even when a case is closed, the family can continue to receive those services there, and Tristan and his staff reach out to those families to provide it.
Jenny, may I just comment on that?
Yes.
Commissioners, I don't know, several years ago, you received a presentation, Jeff, you may have to help me, from South Mountain. They were a group that was looking to expand. This facility is in New Bern. Previous, we would either have to go to Greenville, Jeff, or further out, depending on their availability. And Jeff, there is a ribbon cutting, I believe, this month, correct? And I think it'd be great for the commissioners to go and attend that and see this facility, because it is as Jenny said, it is a real benefit to our community to have that resource here locally. And Jeff, it was a partnership between New Bern PD, the Sheriff's Office, the District Attorney, and DSS to work to get that program developed so that we could have one here.
I think Bill got that email, but that ribbon cutting is October 7th from 3 to 5 p.m.
Okay.
The location is.
We'll make sure we follow up with the commissioners that you have that in your box.
The one on,
It's near downtown,
Street.
Pollock Street.
Pollock Street, okay, I know, I drive by it, and I thought,
Okay. Working on the slides, okay. So just to provide some statistics to you in regard to foster care, in regard to the Community Child Protection Team and Community Child Fatality Prevention Team, we meet quarterly and did so this year. We reviewed 8 neglect cases, which involved 11 children. So whenever there are cases that the Department of Social Services is working on that they feel like they need a little more input from community involvement, they will bring those cases to our attention, and we'll staff those cases for more input. Again, substance abuse, intimate partner violence, and untreated mental health issues remain the leading contributory factors in these child abuse and neglect cases. In regard to child fatalities, the Craven County Community Child Protection Team is combined with the Child Fatality Review Team. 13 child fatalities came to the attention of CCPT for review. We are required to review fatalities that are suspected to have resulted from child abuse, neglect, or dependency, and the county DSS has had some contact with these families through its child welfare programs within 12 months preceding the child's death. State law also requires that we do intensive reviews on child fatalities which have occurred involving children and families that were actually involved with Child Protective Services within the 12 months preceding the fatality. Those fatalities involved unsafe sleep. Both of those families did have CPS history. There were 5 homicides, 4 of which had CPS involvement, 5 medical, 1 with CPS history. Some of those were due to genetic factors, and then 1 drowning, which was not involved with CPS.
We're looking at moving forward in 2021. Substance-affected infants, you can see that was an increase there, and it continues to be an increase. So with that, at any case staffings with in assessments when a child comes in, we have a member of management, myself, Deborah Walker, Jeff, or Sherry, attend the CPS case decision, making sure we're in agreement, making sure those children are safe and how we need to proceed. We have 3rd level consultation with management on the safety plans for all substance-affected infants, When a case is received, it goes out and becomes initiated. We have that social worker contact the supervisor, myself, Deborah Walker, Jeff or Sherry, and to make sure we approve that plan, that that child is in a safe home and a safe environment. And then with in-home cases, we are now taking several of those cases to court for court oversight, especially with families that have their child placed in a temporary safety provider. And we continue to utilize the PFE providers for families involved with mandated services. Recommendations from our CCPT meetings is to continue to provide the free car seats and the pack and plays as funding permits, partner with medical providers and other community partners in providing educational information on suicide prevention, child mental health, and safe sleep. And we feel this information would be very beneficial if we provide that in multiple languages. Identify and provide additional substance use treatment options to address the mental health and the substance-affected infants' birth in our community. Advocate for quality, accessible, and affordable mental health and substance use services through collaboration with Trillium Health Services and private providers, and continue to provide sufficient funds for the Department of Social Services to enable the provisions of quality protection services and supportive family services for families.
And again, as the district administrator for the Guardian Ad Litem program, I work with 3 counties, and I can say that the child protection team here in Craven is just, really does an excellent job bringing everyone together to bring these recommendations to you so that we can make sure children are protected. We want to thank you all for your continued funding and support for the Dix Center crisis beds to help address the opioid crisis, which again, as you can see, just continues to grow. Continued support of the annual Embrace Recovery Rally, which we had Saturday, which was a great success. And also supporting additional local mental health and substance use services for children and their parents. Working with families, next slide, I'm sorry. With families in crisis is tough. One of the things that we have truly embraced in child welfare is focusing on the strengths of families. We're asking not what is wrong with you, but what has happened to you. It's a belief that people are doing the best that they know how and that there's potential for change in everyone. And the quote that we have for you is, sometimes there are moments of complete darkness that you must go through to find your way towards healing. There will be difficult days, moments you struggle. Some days you'll notice growth, other days you won't. But if you keep on walking, knowing that the light isn't far away, you'll slowly start to notice hope blooming in your heart again. And that's why we continue, all of us, to do what we do and why we need and appreciate your continued support. And our last slide, as a voice for the children of Craven County, we thank you. Are there any questions?
Questions from the board? Commissioner Lyon.
Are you getting the support, the necessary needs from Trillium?
We are. Partnering through Partnership for Excellence, that PFE program, we found great partnership. It's really helped bridge that gap in services. And I can say, since we have began services with PFE, we have not had one child spend the night at the Resource Center overnight because of not being able to find a placement for them. They have helped us identify placements, 3B respites, and things like that. So it's definitely been a good collaboration with Trillium.
Thank you.
All right, other questions?
How are you doing outreach to the community to get more foster homes? I know it's challenging during COVID and with it, but by the same token, there's an increasing need for it. And how can we, as commissioners, help?
Well, it has been a challenge with COVID because we haven't been able to go out and do our community events and stuff like that. But we actually have 2 new workers over there, licensing workers, and they have been talking with the schools. They have been talking to local church groups. Of course, word of mouth, talking to other foster parents that have been foster parents previously and now. So just really partnering with them. I know they have some things coming up in the future that they really want to get out and do in the community, but a lot of that has just been telephones, network, and just really do that. I would say for now, we have increased our numbers.
Mr. Chairman, what are the qualifications for foster homes?
We have to go in and see, like your income level to make sure that you can support a child. You have to look at your housing situation. you have to look and see if they have any CPS history, any criminal charges, and really the desire to want to be a foster parent and to meet these children's need and to partner with the families that they come with to do that shared parenting.
Okay.
Any additional questions? I think this is probably the most troubling report that we receive as commissioners. It always has been for a number of years, and especially when you talk about fatalities for the youth. And then also one that I've always been of great concern about is the substance-affected infants. And my question would be to you, I think I probably ask this every year, but I'll ask it once again. With most of these children, I mean, is it long-term effects for them? I mean, are you seeing, and you may not review it that long, you know, but I mean, are you seeing a great consequence as a result of them being exposed to drugs?
So there's actually a lot of research going on about that right now. I think initially there was a lot of belief that this was kind of like a life sentence for these children. And they were described as being addicted to drugs when they were born. New research from the National Drug Institute is saying that it's more of a condition, not so much an addiction, even though they are significantly affected when they're first born. And we do witness them going through those withdrawal symptoms as the drug leaves their system. But in terms of long-term, now they're starting to say that it is not as dire as I think that we once believed, but I don't think we need to minimize that, because clearly it's an impact on a global scale, because it's not just the fact that the parent is using substances. There are, is also dynamics in the home, the reasons why parents use substances, that leads to neglect and potentially other abuse. So I think there's a lot of factors to consider in terms of what that long-term generational effect is for kids. I hope that answers that.
It did, and I thank you for that explanation.
Yeah, you did a good job.
Chair.
Yes, sir.
How often do y'all go out and visit your foster parents, make sure the children are taken care of?
The foster parents?
Yes.
We're required to make at least a minimum contact once a month. Sometimes more, it's based on the needs of the family, but policy says a minimum of one time a month with the foster parents.
And I will say the guardian ad litem volunteers that we have also make at least monthly contact. So you have not only DSSIs, but you also have our volunteers that are making contact with the provider.
And they come back with a report to let you know that everything's taken care of.
I'm sorry?
They come back with a report when you check the house out, if the foster parents are living?
Yes, they actually go to see the children in the home, as long as it's COVID safe. So they're seeing them in the home, and before they're placed back in the home, DSS has significant contact, and so does the guardian ad litem.
Last thing I would just say, Saturday, as Ms. Tracy said, they had the Embrace Recovery Rally here at Union Point. A great event. I appreciate the participation from both of you and from our health department at DSS. We have many community partners that help every day to promote recovery, and that is what we're advocates for. Former Chairman Mark, during one of his terms as chairman, he rallied hard on behalf of this Board of Commissioners to have a program here in Craven County. I think we have a lot of success stories. We heard two of those Saturday from Richard Moorfield, who moved here and told about his life experience, but also Mr. Greg Singleton, whom we are all very proud of for his leadership in our community, and he shared some good stories too. So thank you both for what you do. Thank you two gentlemen for what y'all do and your leadership, and there's so many more. And we got a great county staff that has advocated, and Jasmine, she's doing a great job. We appreciate her. So any additional questions this morning? Not, we thank you. Appreciate you being here. Commissioners, next on the agenda is the consent agenda. You have there two items before you today, the September 7th, 2021 regular session minutes, and then you have the tax releases and refunds. Are there any items to remove from the consent agenda?
So moved.
Hearing no items, we have a motion to approve as is.
Second.
I have a second. Any discussion? Hearing none, Madam Clerk, if you will, please call the roll.
Commissioner Mark,
Yes.
Commissioner McCabe,
Yes.
Commissioner Mitchell,
Yes.
Commissioner Smith,
Yes.
Commissioner Liner,
Yes.
Vice Chairman Booker,
Yes.
Chairman Jones.
Yes. Thank you. Departmental matters. The first that we have today is from the Health Department, Mr. Scott Harrelson, our Health Director. Good morning, sir. Scott, I think it might be a good idea, if you will, as we're going to be talking about, I know, some areas today that's going to involve our school system, our younger generation. And I think it might be productive and helpful if you might share with us, before we get into today's discussions on these budget amendments, to talk a little bit about your collaboration and what is going on between the Health Department and Craven County School System, if you don't mind.
Yes, sir. We have been in touch with Dr. Miller and also Amy Heflin and Luann, the nurse leadership with the school nurses. And what we're doing right now is basically they are the boots on the ground. There are 23 nursing positions. I don't know that all of them are full. As a matter of fact, I'm pretty sure there are a few vacancies right now. But the way this unfolds, not only in Craven but across the state, is that under my authority for quarantine, then the school nurses and also other medical providers in the community that give quarantine and isolation guidance, we all kind of work together to make sure that that occurs. These school nurses are boots on the ground. Like I said, it's a lot of resource to leverage because there are 23 school nurses. Right now we have one communicable disease nurse and 2 other nurses that assist her with this as well. And there's also state contact tracers that are handling the contact tracing across the state. They were diminished when the number of cases bottomed out not too long ago. Then the Delta variant hit and cases increased. We're about 100 cases a day right now. So it's understandable that there's a lot of case activity within the schools. They are one of the unvaccinated populations. So when you have 100 cases a day, you can be almost certain that you're going to have activity within the schools. So this has put a lot of work on the school nurses, and I think that they've responded to it well. There have been some instances where we were probably overzealous with the with basically quarantining individuals without a confirmed positive, so we talked that through. And that didn't only happen here in Craven, it happened all over the state, as erring on the side of caution when somebody was symptomatic. Because we also had a situation where you had other illnesses that were very similar symptoms. I mean, fever, malaise, and then they would have a rapid test at a local pediatric office and come to find out it was not COVID. But then there may be siblings and the case or the index case out. So now we're saying, okay, after 24 hours symptoms subside, they can go back. After 7 days with a negative test, they can return to school. If they don't get tested, they can return in 10. If a pediatric office basically says this isn't COVID, that they can return. If they have the masking, the way the mask guidance was laid out from the state, it really drove you to masking, because if 2 children have a mask on, one of them is symptomatic and the other one was wearing a mask, then they get to stay in school. If they didn't have a mask on, then the guidance is to send them home. So what we're doing now is we have a state contact tracer that's been placed for our area, and her priority is with working with the nurses. And this morning we also have some liaison money that just came through, $115,000, and we want to hire 2 additional nurses. So hopefully soon we'll have 3 more people to assist with the contact tracing. And overall, if I added up our COVID funding, now we, through the FQHC and the Health Department, we have received funds. And right now for the COVID-related dollars, we're at $2,726,066. And good portion of those were utilized when we did the mass dispensing down at the convention center. That was a lot of people, a lot of resources. And now we're hearing about the booster doses, and it seems like 65 and older is where that's hitting, at least initially. And we do have some availability at the convention center. I've just learned that I think the Marine balls have been canceled for the time being due to COVID, and that has opened up some availability there. And we also have CCHC and Carolina East that have pledged their support to work with us to provide booster shots in mass down there.
Could I ask one more question? As far as our percentages, are you seeing when you do the testing and of those that are testing positive? I mean, have we got to our peak yet? Do you think we're close there? Are we on a downward trend? Where are we at?
I do hope we're at our peak. Right now, we're at about 14% positive here in Craven County, and then for the state of North Carolina, it's close to 10% positive, and we're at about 100 cases a day. And another bit of information I'd like to add is, you hear about children in hospitals, but for our region of the state, this 30-county Northeast region, it only accounts, 17 and under only account for about 2% of hospitalizations. And by and large, at our local hospital here at Carolina East, that it really hasn't been an issue with children being admitted to the hospital for COVID. So that's fortunate. And if you look at our 50 to 64 age range, which not too long ago was probably in the 40%, high 40s vaccinated, at least one dose, now we're up to 68% of that group. And I think it's a combination of things. 65 to 74, we're at 90%, and 75 plus, we're at 92%. So we have a very high, that's higher than the state average vaccination rate for that at-risk group of 50 and older.
All right, before we get into our budget amendments this morning, is there any questions for Mr. Harrelson? I know you may have more as we go through, but any at this time? All right, hearing none, we'll go through. We've got a long list here this morning.
Yes, sir.
The first one here is the COVID-19 vaccination program budget amendment.
Yes, sir. This was new funding. It came in for 716. This is CDC money passed down to each county health department, and our amount was $64,257. And those mass vaccination campaign for boosters, this will actually go to the people who are giving the doses. And there may be questions from the community as to why, if this money's floating around, just hire some more nurses to help. That's easier said than done. It is difficult to find nurses in this, well, probably across the nation, but there's definitely a nursing shortage. We had some EMTs and other local medical providers step up, and I'm sure that we'll probably enlist their help again in this effort. So that's $64,257.
All right, questions from the board? Okay, I just want a clarification now. We have, and what you're saying here is this is for the county as a whole, this 64,000. I mean, it's not directed towards one age group. It's for all the citizens of Craven County. Is that correct?
Yes, sir. And that is included in the $2.7 million I mentioned before. We were including this.
This amount is included in that?
Yes, sir.
All right. Other questions?
Make a motion to approve.
Second.
All right, I have a motion and a second to approve the budget amendment of $64,257. Any further discussion on the motion? Hear none, Madam Clerk, if you will, please call the roll.
Commissioner Mark?
Yes.
Commissioner McCabe?
Yes.
Commissioner Mitchell?
Yes.
Commissioner Smith?
Yes.
Commissioner Liner?
Yes.
Vice Chairman Booker?
Yes.
Chairman Jones?
Yes, thank you. The second one is the reopening schools liaison budget amendment.
Yes, sir. This for Craven County was $115,000, and we wanted to hire 2 additional nurses on contract basis. And if we weren't able to find a nurse, we were going to try to hire an admin person because what the school is requested the most helpful with is the contact tracing. With as much activity as we have, they have a lot to do, so that's what we wanted to use these funds for. We know time is of the essence, and pending approval of this, we have 2 applicants, nurse applicants, that we plan to interview today, this afternoon.
Mr. Chairman, can we use paramedics in that case too?
Yes, sir. I think that, the paramedics come in very useful actually giving the shots, and it's not really a vaccine campaign that we're planning in the schools. It's more of contact tracing.
All right, other questions?
Like to make a motion, Mr. Chair?
Okay, we have a motion.
Second.
And I have a second. And that is to approve the budget amendment amount of $115,000. Further discussion? Yes, sir.
I'm sorry but Scott, I just want to be clear. There was I think a question that came through my office. You do not plan on administering any vaccines through this grant, is that correct?
No,
At
sir.
the school sites?
No, sir. That's no plans for that.
Okay, just want to make sure that question came in on Friday. Thank you.
And I was going to ask that. So in reading here, what you have here is when you hire these 2 individuals, they're going to be working in conjunction with Craven County School System, correct?
That is their priority, yes, sir.
And you have down here vaccine administration efforts and tools. Can you explain that?
Well,
I think that may have been something that threw, some people off,
I'm sorry.
myself too.
Yes, that's some language from the agreement addenda that was thrown in with the explanation. And I'm sorry if that caused any confusion, but we have no plans to do any vaccine efforts or vaccine clinics at the schools. This is basically to have these nurses work contact tracing and the bulk, or I won't say the bulk of that work, a portion of it.
For children, teenagers, 12 years to 17, 18 years, did they have to have parental approval, thank you, before they can have a vaccination?
They do. That was a new rule that came out. Initially, it was not so, but now they do. Up until, yes, that 12 to 17 age range.
Okay. Any other questions? All right, you have the budget amendment for $115,000. Madam Clerk, if you will, please call the roll.
Commissioner Moore?
Yes.
Commissioner McCabe?
Yes.
Commissioner Mitchell?
Yes.
Commissioner Smith?
Yes.
Commissioner Liner?
Yes.
Vice Chairman Booker?
Yes.
Chairman Jones?
Yes. All right, item 3 is the Enhancing Detection Activities Budget Amendment.
Yes, sir. This is the larger pot of money. Strangely enough, you cannot hire people to actually administer a shot because this is more along the lines of testing and equipment. But what we can use it for is all of the people who do the registration, the call center, the folks at the front desk as people arrive at the center, rental fee for more supplies. They have large gauge needles that come with the ancillary kits initially. We have purchased smaller gauge needles, which I think everybody appreciates. I know I do. So some of the costs there. So that's $839,607.
All right, questions?
Make a motion to approve.
I have a motion and a second to approve the budget amendment in the amount of $839,607. Any further discussion on the motion? Commissioner Liner.
Mr. Chair, Scott,
Yes, sir.
adding this up, out of the 2.7 million, we just got this $1 million. This adds up to $1 million, these 3 items you're looking for. So in reality, prior to when we had all of our shots and you had the masks and everything, and we had only had 1.7 that we'd got. This takes it to 2.7. And make sure I'm clear that the public is aware and understanding the county is doing this, and it's coming from the health department, which is the county, and we're responsible. But I need the public to understand also The school board has received a large sum of money for COVID to do a lot of this as well. Now, under last year's agreements and everything, with no kids in school, the nurses took on this responsibility. And that was a setup that they wanted to do because they had no kids and they needed jobs to do, so they did the tracing. This has far exceeded their expectation and ours. So the public needs to be aware that the county is not falling behind on anything. We're just now getting into discussions with the school board that they need assistance and help, and then you've stepped up and you've had numerous meetings with them to get them back on track and everything else. But let's make sure that the public is aware the school has money and has had money to do this and has not reached out per se because they had the capabilities and were doing it. But with kids in school, having to maintain that and then having COVID spike as it is, it's burning the nurses out.
Yes,
And we
sir.
fully all understand that. But we've gotten a lot of comments, coming back, well, the county takes it on. County should take it on. Correct. But when an organization says they're stepping up and has been doing it for the past year, we're here. We want to make it happen. We're responsible. We want to make sure it's done. So, but they have funding.
And we have been, I want to say that with Dr. Miller and her staff, we are definitely all on the same page, on the same team. She's been very receptive. I do believe that she has talked about hiring some additional contract staff to assist with the contact tracing with the schools. There are state contact tracers. We just had one placed here locally in the last few weeks that is going to be working with the schools. But what happened to that whole workforce was that it declined and it was let go as the cases really dropped. We have 100 cases a day, but not too long ago we had two cases a day for the entire county. So then this Delta surge hits and they're trying to re-up and bring people back on, and it's just taking time. And I think that the school nurses feel that they're not quick enough. So that's why they got into a lot of contact tracing. But I do think that having that confirmed positive will take some of the workload off with some of the situations we've seen earlier. But at 100 cases a day, it's just a lot of COVID.
Yeah.
Thank you.
Yes, sir.
Other questions? Now, Scott, this funding here, the $800,000, is some of this going to be of assistance to the school system too?
Not really. This is basically what we're anticipating for a very large booster dose campaign. So I think a lot of this will go to that 65 and older population and getting them that booster dose.
It was the other two budget amendments that are more so directed to the school system that we just approved.
The 115.
115.
Yes, sir.
Okay. And I just will go a little bit further in saying that what Scott has said and Commissioner Liner. Jack and I just last week had several conversations with Dr. Miller. I had a conversation with Chair Boomer, also one of the school board members Friday night. And, we all make mistakes. Communication is something that we all can get better at, and I will admit that. I take blame for that. But I asked them, and I think we made a commitment, Jack, on the conversation the other day, that we're going to try to stay in communication better. Jack and I have been meeting with the superintendent and the board chair monthly and trying to keep up to date with what's going on. But maybe there was a lapse in communication. I'm not here to point blame, and what's been done is done. But I think we all have committed, from the health department side, our school nurses, from the leadership here on this board and their leadership, that we're going to try to do a better job moving forward. So, we can't fix something if we don't know about it, and so we're committed. So,
Yes, sir. Crisis response, no time to point fingers. We ought to be on the same team and all get it done.
right. Okay, any further discussion, questions from the board? Hear none, Madam Clerk, the motion is for a budget amendment amount of $839,607. Please call the roll.
Commissioner Mark,
Yes.
Commissioner McCabe,
Yes.
Commissioner Mitchell.
Yes.
Commissioner Smith,
Yes.
Commissioner Liner,
Yes.
Vice Chairman Booker,
Yes.
Chairman Jones.
Yes.
Thank you.
All right, item D is the water sample collection fee.
Two more items. We've got water sample collection fee. We don't do many of these a year. Basically, there are state labs that we do not run in our water lab, and we might see 5 to 10 of these a year. And this is basically a collection fee, a flat rate fee of $35 along with whatever the various water samples that the state would run. And this would involve an environmental health specialist going out to somebody's private well, getting a water sample, packaging it up, sending it into the state. The state responds to our staff and gives them the results, and we call the individual and let them know what it was. And if there was like a total coliform high count present, then we would instruct them in what they would need to do to remedy that situation.
Okay, questions from the board? Hear none, do I have a motion?
So moved.
I have a motion and a second.
Same as the narrative.
Madam Clerk, the motion came from Commissioner Mitchell, the second came from Commissioner Smith. Any further discussion on the motion? Hear none. I don't think I have to have a roll call vote on this, so all those in favor signify by saying aye.
Aye.
Opposed? Motion passed. All right.
Thank you.
The next one is the new and revised health fees.
Yes, we have 4 health fees. 3 of them were basically because Medicaid adjusted their rates, and the 4th one is actually a new fee. So the very first one, our current fee is $53 for a medical home initial plan. Medicaid reimbursement has been raised to $73.50, so we would like to set our fee at $73.50. The second fee is currently $158 for a medical home maintenance visit. The Medicaid rate is now $220.50, so we would like to adjust our rate to that. The third is an oral eval, which really isn't on our dental unit. It's more along the lines of our child health clinic. The current fee is $49.68. Medicaid rate is $57.60, so we would like to increase our fee to $58 so that we can capture all the reimbursement due to us. And the 4th fee is a prolonged office and other outpatient visit, which is new because of Medicaid transformation. This is a new fee, and the Medicaid reimbursement is $82.03, so we would propose a fee of $83.
All right, questions? Hear none, do I have a motion?
So moved.
Second.
I have a motion and a second. Any further discussion on the motion? And the motion is to approve the new and revised health fees. No additional discussion. All those in favor signify by saying aye.
Aye.
Opposed? Motion passed. All right. Commissioners, for Mr. Harrelson Lee, do you have any additional questions for him?
Scott, what's our hospital total? I may have missed that if you said it.
I usually report out on Thursday.
They're averaging about 50.
50?
How many are vaccinated?
80% are not vaccinated.
Scott, also, I think it would be appropriate. I've had right many calls from, and I've talked to you about it, but I think our citizens need to hear it, from parents who, their children have been quarantined, and they've had to go get a test. And some have had to go to other counties to get those tests because they could not find a provider here that could do it in a timely manner. They wanted a rapid test, and definitely, I think I speak for, I know I speak for the majority of this board. I won't say I speak for everyone. But, you know, our goal as a Board of Commissioners is we want children in school.
Yes, sir.
That's what I have advocated to the superintendent, to their board chair. We have no control over that. We've taken positions on this over the last year or so. I still personally think it's a choice, whether you wear a mask or you get a vaccination. It's a choice of the person. But again, Board of Education and the state, they've made their choices, and I'm not in that fight. As a parent, I have concerns, definitely. But the calls that I'm getting at the current time is from parents that are looking for resources for testing. So can you tell us what our health department is doing to assist with testing, when we're doing it, and so forth, so that message can be shared?
Yes, sir. Right now, we are doing drive-up testing Monday through Friday at 11 o'clock every day of the week. We also have another group from Greene County coming in at Without Limits Christian Center on Tuesday mornings. They're doing drive-up testing there. And then Goshen Medical Center's site here in town, they're doing testing Monday through Friday as well. I think Tuesday and Thursday are their late times.
You may have that on your Facebook page, but if you don't mind, let's just try to push that as much as we can, and on the Health Department Facebook page. Also, if we can do it from the county side too, I think that message needs to go out.
And we have had most of that 11 o'clock testing is for, like you said, school-related issues. People needed to be tested. We may revamp that and just go to certain days of the week and just do it for longer periods of time.
I don't mean to prolong this, but I just want to make sure. Our school nurses, they know about this time that we have at the health department. Are they sharing that information with parents?
Yes, sir.
Okay.
They are.
Okay.
And that's relatively new. We haven't been doing that for very long because the pediatric offices were getting overwhelmed with testing requests and stuff, and that's why we got back into doing that.
Okay.
Are these the rapid response tests, or are these the several days tests? I use layman's terms.
A little of both. We do a rapid test for the symptomatic, and then we send off of the PCR.
All right. Any additional questions? Scott, we put you through the meal this morning, but we thank you.
Thank you for your support.
Again, we thank you for what you do and your team, and difficult times, no doubt.
Yes,
Thank you, sir.
Thank you.
All right, next on the agenda is Planning Department. Mr. Don Bumgarner. Good morning, sir.
Good morning. Good morning. We have two items this morning for you. The first is dealing with just setting a public hearing for the next and upcoming CDBG application that we plan to submit on October 14th. We are requesting the board to set this second public hearing for October the 4th at 7 p.m. at your regularly scheduled meeting. The purpose of this hearing is to obtain views of the citizens, answer questions posed by citizens, in the county's intentions to applying for the funding. We're going to give some ideas about the type of funding that we are going to look at trying to apply for the FY 2021 Community Development Block Grant Program. The public hearing will cover the county's community development needs, its proposed activities, a review of the program compliance, and submission of the actual funding application. This CDBG program can fund a variety of different community development activities, including housing rehabilitation, clearance, relocation, substantial rehabilitation, reconstruction, replacement, and/or emergency repairs. And the funding to undertake all these activities is actually part of the program administrative budget. The county is looking to apply for up to $750,000 for this community development block grant. And as I mentioned earlier, we're looking to have it submitted by October 14th, and we're here to request the board to set the public hearing for October the 4th at 7 p.m.
All right, what's the desire of the board?
Mr. Chairman, does that include flood mitigation also?
No, sir. This is dealing basically more with housing and public.
And that's coming from the federal?
Coming from the federal government.
Goes to the state?
Goes to the
And then it
state.
comes to us?
Yes, correct.
Because I noticed the state budget, there's an awful lot of veto going on, and it has to do with flood mitigation and also block grants, and I'm just wondering where it stands. Okay.
Sure.
Commissioner Smith.
I understand that you said that this is going to be directed toward homes, housing. However, I have been getting concerns, and I have shared some of them with you, about the conditions of the roads, and some of that is caused by the floods as well. Is there any possibility of getting grants that can go toward correcting roads? The problem is some of the roads in some of the communities are not state roads. Developers go in and build houses, and they don't turn the roads over to the state, so the state does not go in and repair these roads. This leaves the community with problems. And I'm wondering, I'm trying to find a way to address these needs, because I found this to happen in mine.
But we've been down that road a lot, Ms. B, over the years.
Many years.
And Don, I'll let you give your professional.
I mean, since this is some money that's coming to,
Don, can I just point you a certain direction? I think Commissioner Smith would benefit from what used to be called the Neighborhood Revitalization Program, which was a great tool for that. However, if I'm not mistaken, since about 2016, it remained unfunded and was a program the state chose not to emphasize as much as they did the CDBG side, which is putting houses back. But I just thought, just make sure you mention that as you.
Sure. And one of the key issues with this funding is it is only meant to benefit people that are 80% below what we call median income, which ends up with the situation that if you have, let's say you're going to spend money for road improvements, 100% of the people have to meet that 80% below median income. And that's a key problem with some developments, because some folks, they have two people working in a household and they're certainly not rich, but they go over that limit.
I understand.
So we actually looked at the neighborhood that we had discussed with you. We're still trying to explore options on that, much as we've done for all the areas that the commissioners represent. And we'll continue to try to work on that. But this particular program would not work for that situation.
okay.
And Don, the neighborhood revitalization, I was thinking about some of the things we did in James City back around 2012, 2015. That program has not received the funding to us that we used to get, which did go in and take care of some roads.
Correct.
But you also were able to hit it's a good point you made. I'd forgotten about, you do have to hit those target income levels on the whole road, which makes it challenging from time to time.
Definitely.
Mr. Charlie Simmons used to advocate for this a lot, Ms. B. He'd come to this board about that one issue more so than any other through the years. So that's why I said we've heard it before, and it's not that we just heard it. We've tried to do something about it, but we have not been able. Other questions? All right, if not, do I have a motion to set the public hearing for October 4th?
So move.
Second.
Have a motion and a second. Any further discussion on the motion? All those in favor signify by saying aye.
Aye.
Opposed, motion passed. All right, item B.
Item B is dealing with our process that we actually applied for some funding for the Craven County schools to install generators at 5 different schools within the county. We went through the process. We got a grant award from Golden Leaf, and we went through the process of putting the actual project out to bid in July of this year. We solicited bids for all 5 schools, and this is to deal with situations when there is no actual power to that school. We've got to keep those situations where we need conditioned spaces in there so that we don't have a problem with mold or mildew that occurs in those facilities when there is a lack of power. So we actually looked at 5 school locations, and we applied for funding from Golden Leaf for the J.W. Smith Elementary School, Tucker Creek Elementary, Havelock Elementary, West Craven Middle School, and the Arthur Edwards Elementary School. As mentioned, Golden Leaf did fund a project for the county, and as a result of it, when we went out to the actual contractors for bids, we did receive bids back on all 5 schools. However, the problem that we had, the amount of money that was bid came in $1,862,671 over the budgeted amount that we had received from Golden Leaf. Therefore, what we are looking to do is to try to take the money, the grant money that we received from Golden Leaf, and undertake to do 2 of the schools on our list. That would be the J.W. Smith Elementary School for $440,943, as well as the Tucker Creek Elementary School for $606,443, for a total of $1,047,396. The reason we looked into why we were seeing such a change in our pricing, one thing, it had been probably about 15 months since we had received proposed estimates on what those schools would actually cost to be able to place emergency generators in them. And as a result of that, the contractors, we talked to the contractors about this, they said that their labor cost had gone up as much as 15% during the time period from our initial estimates, as well as the cost of the generators had gone up almost 400%. And the other problem is that there is a tremendous delay in the actual delivery of generators by as much as 8 months before we're going to be able to actually receive the 2 generators that we're proposing to make awards for. So it's a supply problem, a labor situation, as well as a tremendous increase in the cost of the actual item itself, the emergency generators.
And I'm gonna take it from there. So Don is proposing J.W. Smith Elementary and Tucker Creek Middle School, Don.
Yes.
Those were the 2 most affected after Hurricane Florence with mold and mildew and water issues. Numbers 3 through 5 will be covered by the Craven County School System with some funds they've identified. So all 5 schools will actually get done, but we can only approve 2 because that's all we're allowed versus our grant money from Golden Leaf. But I spoke with Dr. Miller last week, and she really understands the importance of emergency power at those 3 schools and getting school back in very quickly after a hurricane. So she has pledged, and I can't explain exactly how they're filing the money, but they have the remaining $1.8 million in money that they can use to make this project whole. So it will get done totally. Just our portion would only be about half, roughly.
Right. And they're actually the school system is going to use everything that we've done to date in the way of the detailed engineering estimates and the entire process of bids that we went out for. So,
All right, questions from the board?
How long ago were those bids done?
our initial estimates, they were 15 months. It's probably been at least 2 years now. They were 15 months before when we went out to bid. They'd been 15 months.
So if it went down, it went up because of inflation.
Well, there's a lot of problems in the supply chain because of COVID and people not.
Don, I think the question was when the bids were received. They were received right around the 1st of August of 2021.
No, I was asking when they got the bids.
They got them in August of 2021.
Yeah.
He's talking about the original
Yeah,
project
right,
scoping was
You're right.
15 months,
You're right.
15 months
The
ago.
scope of work was a couple of years ago.
Yes.
The bids are 2 months ago.
Right.
Right, that's correct.
And they're good for how long?
This is one of the reasons we are moving forward here at this time, because the contractor that's doing that work has given us to the end of this month, and then after that, he's going to revise his numbers. It's not that he's having, that he personally wants to do this, it's that the vendors that he's gotten the quotes for will only stand for so long on the cost of that equipment.
The only thing I will say, I don't know, with the other three, school system I reckon they need to know the timeline too.
Correct.
I think they wanted to see the Board of Commissioners act this morning, then they can act very quickly, I believe.
All right, additional questions? Hearing none, the
So moved.
request is to approve the coastline electric construction for these two schools. I got a motion from Commissioner Mitchell. Do I have a second?
Second.
Second from Commissioner Smith. Any further discussion? All in favor signify by saying aye.
Aye.
Opposed? Motion passed. Thank you, Don.
Yes, sir. Thank you.
Appreciate All right, next we have Mr. Jeffrey Merritt from Social Services. Good morning, sir.
Good morning. I need to just inform you that late on Friday, in regards to these funds in which we submitted a budget amendment for, we were made aware that there was going to be additional funds allocated after conversations with other local county Department of Social Services and the state, that there was a need for increased funding if it was available. What was referenced in a previous call, I think, that took place last Wednesday. So we had another call on Friday at 1 o'clock, and they informed us that they would be releasing additional funding that was appropriated through the Consolidation Appropriations Act. It was enacted on December 27th, 2020. And we've got those figures in an email. I think it was 5:34 p.m. on Friday. So so I have given each of you and given one on record for the clerk an amended agenda item submission form, which includes an amended budget amendment and the latest letter dated September 17th, 2021, also which you will find the amended allocations. And there was a PowerPoint presentation there that just wanted to let you see that kind of bullet pointed some of that Dear County Director letter. But these funds that, as I said, how they were funded through the federal government are for the children who are in foster care. And you will see those children who are at least 18 years old and not yet 27 who were in foster care at age 14 or older and are eligible. And this is a one-time financial assistance for them. They've identified that many of these children were not able to receive the stimulus funds through the previous funding packages related to the COVID-19 pandemic, and they are trying to provide them some financial assistance because a lot of these children now are either young adults or are in school, and these funds would go towards helping them fill gaps that maybe they were affected by the pandemic, either for school or their regular living situation. So as you can see, eligible adults age 18 through 20, the amount that they will receive is $2,500. Eligible adults ages 21 through 26 is $5,000. We have been working hard, our staff, to identify these children. We do have children age 18 to 21 who we've reached out to, even other children who have, well, not children anymore, young adults who have aged out of foster care. These funds right here will not cover all of those, but we were asking you to allocate these funds if we reach out to them and we're able to verify and able to get these money to them. So, it's kind of going to be like some of our other programs we have where we have a cap funding amount. And, once the money is gone, it's gone. There could be some more funds come later. But according to the federal government, that these one-time amounts have to be done by September 30th. If something changes, we will let you know. If there's anything that we know there's other funding coming, we will try to work with Jack and the county finance office to see how we can kind of move with that and get any additional funding later. But I just want to let you know that too, that this is not funds to where the state identified all the children who would meet this criteria in Craven County who are in foster care at age 14 and are 18 to 26 years old now. We're going to try to get those funds out to, we've already committed all these funds, identified enough to expend these funds, and even more so. So we're going to try to work with the state to try to see what else there is that can be done.
So the number we're talking about is $73,680?
Yes, that is what it is now. That is 4 times our original links funding allocation, which will still be utilized for what we budget that for. It's for administrative costs. We do have 2 workers that work with children in foster care ages 13 through 21. Remember, we do have that 18 to 21-year-old foster care program, and those in that program are either in school or working. And so we'll still be using some of those funds for activities in which what we try to do is promote independent living skills. We try to get speakers to come in and talk about financial advisement, just activities of daily living, try to, bring in speakers from universities, to let them take tours of universities, things like that, to try to give them skills to let them know what options are for hopefully for them becoming independent once they reach the age of 18 or especially past 21. So,
Any questions from the board?
Are you saying some of these people are working?
yes, sir.
All right, other Commissioner Mitchell.
If I did my numbers right, and I'm not a math person, this 73,000 will cover maximum 30 people.
Yeah, around that.
That's 25 to 30.
Yeah, it's not very much.
In terms of, for all of the young people who are eligible for this, you said there's going to be a delta. Okay. How do you identify priority cases, or is this a first identified, first served?
It's a first identified, first served. We're trying to go through our children that we know 18 to 21 right now, because we know those children are in school or either working, and if there's additional funds, we'll start, we still do have some connections. I mean, because some of those children were in our care for some time, and maybe trying to reach out to them to get an idea of what their current situation is. We are trying to make sure there's not any, shall I say, risky behavior associated with some of these individuals. So there wasn't a lot of guidance from the state there. It was, counties, you go ahead and, take these funds and
Use your best
places there,
judgment.
yeah, and use discretion. Yeah.
Commissioner Smith.
Now, these young people get these funds in services, not actually cash, is that correct?
No, these are going to be in actual cash. This would be just like a stimulus check that anyone else got. It would be a check made out of there.
All right, additional questions? Hear none, do I have a motion?
So moved.
Do I have a second?
Second.
I have a motion and a second to approve the budget amendment in an amount of $73,680. Any further discussion on the motion? Hear none, Madam Clerk, please call the roll.
Commissioner Mark,
No.
Commissioner McKay,
Yes.
Commissioner Mitchell,
Yes.
Commissioner Smith,
Yes.
Commissioner Liner,
Yes.
Vice Chairman Booker,
Yes.
Chairman Jones.
Yes. Thank you,
Thank
Jeff. Appreciate it. All right. Commissioners, do y'all need a 5-minute break?
Yes.
Will, let's take a 5-minute recess, and y'all can be prepared for our carts presentation.
Announcements and paid advertising on television and radio, use of bus stop location signs to advertise omnibus, continued participation in community-sponsored events, other human services agencies, and written advertisements such as flyers within the service area of the omnibus routes. For reference, included in the agenda package is attachment 6A, is the presentation that you received on May 17th. Parks is requesting approval for a launch date of December 1st for the omnibus plan and an ending date of November 30th for the loop.
All right, Commissioners, any questions from Ms. Walker?
Yes, I have one.
Yes.
Kelly, you've got a pretty extensive list of advertising sources, but I don't see anything about social media. Should we be having a Facebook? Should we not be having a Facebook page to also, do you have a Facebook page?
Parks does not have a Facebook page. We use the Craven County, but certainly we
Okay.
can work with, in regards to
I
that,
think that would be
yes.
good. That's one more option.
Sure.
And I would echo Commissioner Booker's comments over making all of the carts information really pop on the Craven County Facebook page, because one of the comments that I have repeatedly heard since moving here is it's hard to find that information. And some people are really good at going through websites, and some people aren't.
Okay.
With it. Now, I'm delighted to see the changes in the services. I think it will serve our community a whole lot better. And I think if you ramp up getting the word out, which you are clearly doing and doing more of, I think that would be fantastic.
Okay, thank you.
Any other questions, comments? All right. Not, do I have a motion that we approve this new route?
So moved.
Second.
I have a motion and a second. Any further discussion? Hear none, all those in favor signify by saying aye.
Aye.
Opposed? Motion passed. All right, B.
Next item is information regarding our fiscal year 2021-2022 Rural Operating Assistance Program, known as the ROPE. It is a state-funded transportation grant program that's administered by the North Carolina Department of Transportation Integrated Mobility Division. ROPE consolidates the Elderly and Disabled Assistance Program for the rural and urban areas of Craven County, the Employment Transportation Program for the rural and urban areas of Craven County, and the Rural General Public for the rural areas of Craven County, all into one application. Each county within the CART service area is responsible for making their own ROPE application for its respective county. On September 14th, we were notified that Craven County had been allocated $102,770 for EdTap, $26,721 for employment, and $96,678 for rural general public. The total amount is $226,169, which is a decrease of $6,551 from fiscal year 19 to 20. There was not an allocation for fiscal year 2020-2021. The rural general public requires a 10% match, and that's covered by the fares charged to the passengers. Public hearing is not required to apply for this funding. And in addition to completing the application, a certified statement signed by the county manager and county finance officer is required. The application deadline is October 1st, and a copy was provided as attachment 6B.
All right, any questions?
Was there any reason given why there was a decrease and why we're not going to have a allocation for 22? Or 21, I'm sorry, 2021?
It's formula-based, and when there's excess ROPE money left over from a prior year, they will place it in as part of the allocation for the following year. Since there was no allocation in 2021-2022, the transit systems believe it is because they have that extra money to put in there. Okay. The reason it was not funded last fiscal year is because of the CARES Act funds. The state budget did not approve these funds because with the CARES Act, it was assisting with 100% of expenses.
Right. Okay.
Other questions? Hearing none, do I have a motion?
So moved.
Second.
I have a motion and a second that we authorize staff to proceed with the application process. Any further discussion on the motion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed? Motion passed. All right, item C.
Okay, this is to request authorization to apply for state maintenance assistance program. This is kind of the urban version. State Maintenance Assistance Program, or SMAP, is a state-funded transportation grant program administered by the North Carolina Department of Transportation. The intention of this program is to provide operating assistance to urban, small urban, and urban regional fixed route and commuter bus systems. Eligible uses of the funds are limited to a system's operating cost. On September 14th, we were notified that we had been allocated $130,920 for fiscal year 2021 to 2022. This is the same amount as fiscal year 19 to 20, and like ROPE, there was no allocation for fiscal year 2021. The application deadline is October 1st, and the funds must be expended by June 30th, 2022. A public hearing is not required. SMAP cannot exceed the amount of the local match provided for the 5307 Urban Area Formula Grant. With the approval of this grant, the CART's local match would be $130,920, and the SMAP revenue would also be $130,920. We are requesting approval to apply for $130,920 in SMAP funding. Deadline to submit is October 1st, and a copy of the application is your attachment 6C.
All right, any questions? Hear none, do I have a motion?
So move.
Second.
I have a motion and a second to also apply for this application for SNAP funds. Any further discussion on the motion? Hear none, all in favor signify by saying aye.
Aye.
Opposed? Motion passed. I just want to say, Kelly, let me just make mention, I want to thank you and Roy. I know y'all are short-staffed And it's been shared with me, y'all have been going the extra mile and driving some of our carts, vans, in addition to your other duties. We thank you for what you're doing, your leadership, and we hope by the action that this board took some weeks ago, maybe that'll assist you in getting some new employees. So we hope so. But thank you again.
Yes, sir, and thank you.
All right. Have a good day. All right. Next, we have Economic Development. Mr. Jeff Wood. Good morning.
Morning.
Got 3 items to bring in front of you today. The first is a request for a public hearing. Project Indoor is a local manufacturer, Carolina GSE, who plans to invest $2.5 million in real estate, manufacturing, and equipment in its existing facility and create over 15 jobs in 5 years. To assist in this investment, the North Carolina Department of Commerce has provided a grant of $120,000 under the Rural Infrastructure Authority and the Rural Economic Development Division. This grant will be awarded and managed by the Craven County Economic Development Department pursuant to NC General Statute 158-7.2. The Economic Development Department requests that the County Board of Commissioners to hold a public hearing on these matters at 7 p.m. or soon thereafter on Monday, October 4th, in the Commissioners' Room in the Craven County Administrative Building, and all interested persons are invited to attend and present their views.
All right. What's the desire of the board?
So moved.
Second.
I have a motion and a second to set the public hearing for October 4th, 2021 at 7 p.m. Any further discussion on the motion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, motion passed. All right, item B.
Item B is Project Pittsburgh Budget Amendment. We had a public hearing about this one as well. It's a pretty exciting project. This is Schlott. They are a supplier to BSH, among other companies. They're located at Bosch Boulevard. They're investing about $9 million, converting warehouse space into manufacturing space, creating about 30 jobs. Not only does it help the company itself expand, but it helps that BSH supply chain, which is so critical to our economy. So requesting a budget amendment of $25,000 to go towards that effort.
All right, any questions?
I just have one. You said that this $9 million investment will yield an estimated $50,000 in taxes. That's annually, correct?
Correct.
Thank you.
Yes, ma'am.
Additional questions? Hearing none, do I have a motion?
So move.
Do I have a second?
Second.
I have a motion and a second to approve the budget amendment in the amount of $25,000. Any further discussion on the motion? Hearing none, Madam Clerk, please call the roll.
Commissioner Mark,
Yes.
Commissioner McCabe,
Yes.
Commissioner Mitchell,
Yes.
Commissioner Smith,
Yes.
Commissioner Liner,
Yes.
Vice Chairman Booker,
Yes.
Chairman Jones.
Yes. All right, item C.
Third and final thing I'm bringing to you today is a request to purchase property out of the industrial park. 2 local businessmen have put a purchase agreement in place requesting to buy 6.38 acres of Lot 19. Their intention is to, after a due diligence period, to build a 20,000 square foot shell building expandable to 40,000 square feet. Pretty exciting from an economic development standpoint. The story that the Craven 100 Alliance, in partnership with the county, built our own shell building. It sold. We had outside investors come in. They built a shell building. You can go see it being constructed right now. It's now been sold, and now we have local investment. So it's definitely been a proof of concept that's been successful over and over again, and hope to continue to be.
All right, questions? Hearing none, do I have a motion?
Make a motion to approve.
Second.
I have a motion and a second to authorize county manager to enter into a contract for 6.38 acres of property within Lot 19 Industrial Park. Any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed? Motion passed. Thank you, Jeff. All right, next, Commissioners, we have appointments under pending. Do any of the Commissioners have any nominations for any of the pending appointments? All right, here none. We go to current. We have one today, the Juvenile Crime Prevention Council, Ms. Tracy Monk. She is eligible for reappointment, Madam Clerk.
She is.
Okay.
I'd like to make a motion that we nominate Ms. Monk.
All right, we have a nomination for Ms. Monk. Are there additional nominations from the board? Here none, she will be accepted by acclamation. All right, you have upcoming terms expiring in the fall of 2021. Please take note of them. Any other appointments to bring before the board today? Here none, we go next to the county attorney's report. Mr. Grady. Good morning, sir.
Good morning, Mr. Chairman, Commissioners. I have one item for you this morning. It is the proposed sale of county-owned property through the tax foreclosure process. This is the parcel that we discussed at the last meeting. We had some questions on access and things like that, and followed up with an email to Nan and Jack that I hope all of y'all received. I'm glad to answer any questions on that particular aspect, but the parcel number is 1-028-6001. It's outside of Vanceboro. We've got an offer in the amount of $3,800. The property's past due taxes and cost of foreclosure were $32.99, and the tax value is $13,500. If the board gives preliminary approval, we'll put it through the upset bid process and have it back before you at some point. The legal description, as it's been stated historically, does include an access easement that was brought forward in our commissioner's deed during the foreclosure, and it'll also be granted out to whoever winds up buying the property. So as things stand now, there will not be any legal access issues with the parcel.
All right, any questions?
Mr. Chairman, along with Mr. Grady, I took an independent look and talked to some of my folks who are familiar with that area on the county staff. It clearly is an error situation where you have different owners after there was a passing away of a family of parents. It's hard to make heads or tails of who's in charge or who's doing what, but I agree with Mr. Grady. There is access, which was a key point. If there wasn't access, I think it changes a little bit, this sale. This is a pretty good offer based on my review of the property. I mean, obviously, you have to judge that. But
I had made a motion last meeting, and I'll make the same motion, that we go ahead with it.
All right, we have a motion.
Second.
Have a second. Any further discussion on the motion? And that is to adopt the resolution approving the transaction and authorizing upset bid process. Here, no further discussion on the motion. All those in favor signify by saying aye.
Aye.
Opposed? Motion passed.
That concludes my report.
Thank you, sir. County Manager's report.
Thank you, Mr. Chairman, Commissioners. Appreciate the opportunity. I'm going to be brief today because I know we have quite a few things still to handle. We'll remind you we have a closed session immediately following your comments for attorney-client privilege. Mr. Grady will cite that as we go in. Also, we have a small recess, Mr. Chairman, to go into a workshop after for redistricting. We'll have our consultants here today. Two things I want to make the board aware of. They're two pretty big picture items, but we need to be thinking about it. And I want to get one out, which is the American Rescue Plan dollars that were authored back in the spring. And we've continued to look at the different guidance that's been put forth. It is not final yet. I just wanted to update the board on that. We do, and I'm looking at Mr. Warren in my office, we do expect final guidance by the end of October. And the reason that's important is because we've got a lot of ways we could go with this money, but we don't want to pick a path and start running to find out that we can't go that way. There's still a lot of gray area. As we meet with our team locally here, county folks, we get down on a project, and then at the last minute we realize, hey, that might not work. So we're hopeful that the final guidance from Treasury will allow us to begin the process to present that to the board and then budget this money and move forward. The other thing, and everybody's heard about it, no one's really talking about it a whole lot, but there was a plan from the executive branch of the government to talk about vaccination rules and how that will impact our operation here at Craven County. I do not have a lot of clarity. I have spoke with Ms. Parker, our HR director, along with other department heads. You know, there's a couple factors there that need to keep in mind. The proof will be in when the rule's actually written. It will be a Department of Labor rule at the federal level, which means it'll be administered by OSHA. And the state may also look at that and implement some of their own rules. But right now, two things to keep in mind. One was the presence of a mandate of any employer over 100 employees, which would be Craven County. Now, specifically in the press release, it said private company, not public business, which would be government. So there's still some gray area there. And lastly, any medical type facility or organization that receives Medicaid or Medicare dollars, there is a requirement to be vaccinated. Again, we need to see that rule. That one's a little nebulous because there's you think health department, but there are other agencies within Craven County that receive Medicare and Medicaid dollars that aren't part of the health department. We have no action for the board at this time. We're going to continue to interpret the rules, and the time when it is necessary to bring them back, we will do so with Mr. Airy, his guidance as well there, and Jill. So just want to make you aware of that. A lot of counties are out there talking about it, making public statements. I just don't think we're there yet with the rules. Any questions?
Just a comment. I think it's pretty likely that when that is finalized, there are going to be lawsuits challenging it based on the fact that a lot of people are saying OSHA does not have the authority to do this. So I don't think it's going to be, once it's all finalized, I don't think it's going to be rolling forward without any
Exactly.
without any challenges.
And that's why we're not getting excited right now, for that reason.
Do you have any ballpark idea in terms of when you will receive better guidance over what that actually entails? I mean, are we talking a month down the road, 3 months down the road, sometime next year?
Talk about the vaccination part?
Well, right now it's very nebulous.
Yes.
All private companies over 100. What is that?
Right.
What does that mean? So I guess I'm looking for a time frame when we would understand, have some clarification in terms of what it actually means.
So announcing it's easy,
Right.
generating the rules hard, actually writing the rules. So we expect, between now and the first of the year,
Okay.
and then we have no idea what type of timeline they will give for people to actually comply.
Actually-
To Commissioner Booker's point, you could get a challenge, this thing could get held up. I mean, we weren't real excited because we know just the announcement's the easy part. So,
So a while.
a while.
Other questions? All right,
Mr. Chairman, thank you.
thank you. All right, Commissioner's report. Commissioner Mitchell, we want to start with you.
No, sir, I'm going to keep it short.
All righty. Commissioner Liner,
Sir, I have nothing.
Commissioner McCabe.
Yes, I have two items here. You know that this weekend, September 25th, we have the Cherokee Air Show. It's coming weekend, that Saturday. You must have a ticket to get in. The tickets are free. And also the Sheriff Department and the Fire Department, Harlow Fire Department, also hosting the National Night Out at Harlow Community Center, October 25th from 6 to 9 p.m.
Okay.
That's all I have at this present moment.
Okay, thank you. Commissioner Mark.
Yes. Number one, I attended the hospital I was at a 9/11 Fairfield Harbor 9/11 ceremony on 9/11. Second, the hospital, I attended a meeting on passing the budget, which we did. We also appointed 2 new members to the board of the hospital, and I'll leave that up to the chairman to announce. I attended a meeting at Bridgeton, their town hall meeting, and discussed the normal things that they had discussed at a city town hall meeting, roads and conditions, and that was about it. So, also, as far as the night out, Fairfield Harbor has canceled their night out this year.
That's what it goes.
And that's it.
Okay, thank you, sir. Commissioner Smith.
Thank you, Mr. Chair. I thank you for letting me have a few minutes to speak to you because I have something that I'd like to share that I feel is very important that I need to say to you and to my constituents. And so it may take a minute, but not a long time. Now, I would like to begin by sharing with you, if I may, some correspondence to me. I have one open, the others are sealed, and I would appreciate that you leave them sealed because this is my private correspondence. But I want to make you aware of my legal residence. And what I have here, this first one here, and I want to just pass them down. This shows my name, my address, and it's a bill, and others as well. Some of my mail come to me, which is forwarded to me, because as you know, that this was a recent address about a year or two ago. And some come straight to me, but I want you to be aware of the different mails. As I speak to you, please pass that around as I share that. I want all of you to see all of it because it starts from December. It's important that you know that when I came on the board, it's when the time this mail begins. I learned late last Friday, that my fellow commissioners had received a letter with false information accusing me of living outside my district, which is District 3. And so I feel that I need to set the record straight, and this is what I'm attempting to do at this point. Today, I want you to know, I want this to be the official record. I live in District 3. I'm saying that because I want the commissioners to know, I want all of my constituents to know, and anyone who's concerned or interested to know that I am not representing this district falsely. I'm committed to representing District 3, my district, to the best of my abilities. There's been a question of property. I don't usually talk about myself or personal things. However, I must say to you today, as a property owner and a taxpayer in Craven County, I do own 5 houses in Craven County. One of these houses, as was stated in that letter, was damaged and hurricane floored. I was living in the house at that time. However, I was not in the house at that time. I was away. As a result of that flood, I no longer live in the house currently, but I am living in one of my properties, which is in District 3. The house that I lived in at the time of the flood was 1700 Chestnut Avenue. I currently live at 1906 Chestnut Avenue. I have purchased 3 houses on Chestnut Avenue, sold one, but I want you to know that I am living in a property that is in my name. I receive mail, and I'm passing on to these folk behind me as well. And I sleep there. When I got up to come to this meeting this morning, I left from that residence, as I do every day when I leave my home. I consider this my home at this time. I share that home with one of my younger brothers. And I want all of my constituents to know, the person accused me of living at 102 Drummond Road. 102 Drummond Road is a property that belongs to me, outside my district. And I also have another property, a house that is outside my district. The 102 Drummond Road is not, nobody lives there. I have been renovating and remodeling that house for the past year. And some of you in this room may have heard me mention that in the past. I have no intention of living at Drummond at this time. If I were to decide that I was going to change my residence, I would certainly be honest enough and knowledgeable enough to know to come to the commissioners, to the county manager, to the Board of Election and share my changes. I'm a Christian woman, I'm honest, and I believe I live with integrity. And I have not in the past and will not in the future deceive you or anyone to hold any position. It is my intent to do the best that I know to serve the people in Craven County, especially to people in District 3, the district that I'm representing. If I decide to do something different, it's not because of any fraudulent activities. If I have failed to serve, it's not because I'm trying to do something that is not legal. It's my intention to do the best I can with the information that I receive, learn as much as I can, and serve the people that I care about. I have lived in District 3 since 1972. I have no reason or no cause to try to deceive my people. These are my people, people that I care about, and people for the most part, I believe, care about me. So commissioners, I thank you for your patience of allowing me to speak. I know that I may not have spoken as well as I might, but I want you to know that I'm committed to doing this job as best I know. I'm committed to doing the right thing, and I feel that I've done the right thing in the past and will do the right thing in the future for as long as I am on this board, as long as the people choose to have me here. I have no intention at this point. In this letter, I saw that it was stated that I needed to step down, and if I did not step down, that they would go to the media, and I have no problem with that. I'm willing to talk with anybody about what I have done and what I'm doing. I have no problem with anyone, the media or anyone. I'm not a media person, but I'm willing to stand for what I think is right. Thank you.
Commissioner Smith, if I may, Board, also just speak to you. When Ms. B. Smith decided that she had a desire to put her name in as one of the nominees to serve out the term of the late Commissioner Johnny Sampson, one thing I was proceeding into the chairman's seat from our former chairman, and both of us were involved in those discussions at that time with the county manager. But one thing Ms. B told us is exactly what she's saying to us today, is that, you know, she had resided at 1700 Chestnut Avenue for many years. It had got flooded. But she was living down the road at 1906 at another property where her brother lives, but she owns it. And that, you know, she was undecided at the time if she was going to fix the house at 1700 or remain at the location she was at. I think she had moved some furniture and stuff out that she had that had to go somewhere out to the Drummond Road. I have visited her property out on Drummond Road, which is in the district that I represent, District 2, Governor's Mills. The house is not finished. It still has bathrooms that still need to be completed. It is not stocked in the pantry. There's no clothes in the closets. I can attest that. I've seen it with my own eye. Ms. B served prior to this, as we all know, on the Board of Education for 18 years. She was a Board of Education member when she came to the Board of Commissioners. So, Ms. B, I say to you as your fellow colleague here, I attest that you've been open and honest with this Board of Commissioners, and I have no reason to doubt your residency. I do not doubt it, and I stand with you as you go to talk to anybody. I can attest that you have been open and honest with this board. And I have also had those discussions with the county manager and his team. Materials that are delivered to the commissioner, correspondence is given to her at the 1906, and that has been shared with us last week after we received this letter. So I also state that for the record too. Any other commissioners have any questions, concern about it today? All right, hearing none. Commissioner Smith, do you have anything else you'd like to bring before us today?
I'd just like to thank you for your patience.
Yes, ma'am. Thank you. Vice Chair Booker.
Support.
Nothing.
All right. Commissioners, the only thing I will share with you is the coaster of our the landfill. I'll put it to you that way. People know it better as that, if I say it that way. They're going to have a household hazardous waste collection event here in Craven County on Saturday, October the 16th. Saturday, October 16th, 8 a.m. to 1 p.m. at Craven Community College. And that will definitely be posted on their website, so please keep that in mind and share it with folks. All right. Anybody have anything else to bring before the board before we go into closed session?
Make a motion to go in closed session.
Second.
Okay, if you will give us the statute on that.
Yes, sir. It's to consult with your county attorney, and it's also to receive advice on the case of Craven County v. Butler, which is pending in Craven County Superior Court.
All right, we have that motion. We have a second. Any discussion, questions? Hear none. All in favor of going into closed session, signify by saying aye.
Aye.
Opposed? All right.